If you've ever battled piriformis syndrome, you know it can be really difficult. Maybe you're a cyclist, maybe you're a runner, and it keeps you from being able to do what you want to do. We want to show you some exercises that hopefully can get you better. I'm Dr. David Gege, orthopedic surgeon and sports medicine specialist, here with my friend and physical therapist from Made to Move Physical Therapy, Yves Gege. Now, piriformis syndrome is a condition, it's not super common, but if you have it, you certainly know about it, where the sciatic nerve that runs all the way down your leg sort of gets pinched or gets pressure from the piriformis muscle in your buttock, and it can be really uncomfortable. Usually it manifests as buttock pain, may go down the back of your thigh, not usually a lot of numbness and tingling, but it drives you crazy with exercise. So we're going to talk about some things to hopefully loosen that up and maybe get rid of your pain.
Yeah, that piriformis muscle, just as you said, starts to pinch on that nerve, and that causes a lot of the pain and a lot of the symptoms that you're having. So the first thing we want to do is maybe work on stretching that muscle and see if we can maybe take pressure off some of that nerve. So the first thing we'll do is just a simple cross leg stretch. Okay, so we're going to use the bench, but pretty much anybody can use a chair at home or maybe on the edge of your couch. So the first thing you're going to do is kind of slide towards the edge just a little bit.
Okay.
Good. And then we're going to say the right leg is the leg that is painful. Okay, so we're going to straighten that right knee. Yep, good, and rest our heel on the ground. And we can do multiple things to increase the stretch here. You may get a stretch just like that. But if you want to add a little bit more, the first thing we can do is actually, it's called a slump stretch, is just kind of chin to chest. Good.
Okay.
And then you can actually start pointing the foot back. Good. And holding it there. So the stretch will start to increase the more we kind of slump forward.
Feel like that.
Good. And the more you do that, you may even feel that, because sometimes it can be a little hot no matter what you do.
Now, where I should be feeling this sort of back of the thigh buttock, or because I'm feeling it a little bit in my lower back, and I kind of feel like that's probably not right.
Yeah, it depends, right? Like if you have some lower back tightness, I would back off a little bit, and you can. It's actually a good point. If that is producing some low back pain, we'll actually sit a little more upright and then hinge forward. We can still do the kind of chin to chest, but you may feel that now a little bit more.
Yeah, that's more in my hip and thigh. Yeah.
Right, because you should be, as you said, a lot of those symptoms going down your leg, you should be feeling them, in the exact spot where you typically feel the symptoms. So this is something that I encourage my patients to do usually before they get in the car, because it's usually a lot of times where they get a lot of these symptoms, or they need to do a lot of sitting.
All right.
Okay?
What else?
All right, so the next one, which I just realized is what I said before, is the cross leg stretch. So we're going to do that one now this time, right? So we're going to cross one leg over the other.
This way.
Perfect. What we want to avoid here, and I'm just going to demo it real quick, we don't want this ankle to come here, right? We don't want that pressure. That's not going to really isolate the hip very much. So we want to make sure our ankle bone, yes, perfect, right? And in that position, we're going to push down our knee. Same thing as we said before, proud chest, kind of sticking it out.
It's amazing how the posture makes an enormous difference. It doesn't, you don't think it would, but you immediately feel it as you do that.
Yeah, absolutely. Like that pelvic position, kind of, that anterior, posterior pelvic tilt will kind of get everything like a little bit tighter, and you can kind of increase that stretch that way. So from here, usually you're going to feel a stretch like that. But if you want to get a little more advanced, we'd actually start bringing our nose towards the knee. If you got some really mobile people, we have some people who, man, they can get all the way down. I cannot do that.
I'm not one of those people.
Yeah, Dr. Gege is not. Maybe one day, right?
Yeah.
So yeah, holding that probably a solid minute or so, hopefully relieving some of those piriformis sciatic symptoms, hopefully instantly.
Terrific. Yeah, that's one that I probably should do on a maintenance basis.
Yeah,
Really
absolutely. Just standing in surgery all the time, right? Yeah. So the last one, we like this as a hip and core strengthening exercise. So we're actually going to get down on the floor and do what's called a side plank. This is a very underutilized rehab exercise.
Which way should I go here?
Yeah, let's say go with your head over here.
All right.
So we're going to get to the point where actually you're going to push up on your elbow. So you're going to be on your elbow first. Good. And then your feet close together.
Stacked.
Stacked. and holding that position that way. Now this is a tough exercise. You hold this long enough, you're gonna start shaking, right? So we wanna hold that 5, 10,
take me very long.
5, 10, 20 seconds really max, and doing 2 or 3 sets on each side. So I'd love to show a modification too, just in case. So maybe instead of being on your feet, you're gonna press up on your knees. So you're gonna bend your knees a little bit.
Like that?
Yep, well actually tuck your knees in behind you like this.
Oh.
There you go, yep, and then press up, right? So maybe for some of our aging athletes who need to modify a little bit, this one can be a little bit easier, and it's a great way to start.
Okay, terrific. I'm out of shape on my hips. Yeah, so that was actually work.
You did great, man. That was awesome.
Piriformis is a tough problem, though. When I see patients with piriformis, you hate to say this, but you almost cringe because it's tough to get over. It's not something that typically needs surgery, but it needs a lot of work. Working with a physical therapist is super important, but it's not a bad idea to try some of this first. Try to see if that alleviates it. And then once you get better, maybe you keep these exercises as part of a maintenance, sort of a prevention strategy. If you want to check Yves out on social media, the link is below where you can get a lot of just terrific information just like this that can help you stay healthy. We look forward to seeing you in our next injury video. Take care.